So this is a video on LV wall segmentation about the 17 segment model of the left ventricle. We saw different views, which includes the past and long axis, the first one, the short axis views, and then the apical views. So for LV segmentation, we are going to look at the naming or nomenclature of the different segments of the left ventricular walls in those different views, and how we divide them. Echo is so big that whenever it passes, or whatever structure you see, you have to give it a name, or it has a name. So I'm going to start with one view. I go to another one, until when I finish the 17 segments, so that you can actually see them on echo, not the other handwritten or hand-drawn pictures. So here we go. In this patient, and this is our images I'm using. It was a patient whom I got permission to use these images here. So because the view was good, the windows were very clear for this. As you can see here, the window is very clear. So starting straight away, this is a Plax view, past and long axis view. As I told you, I always start with this one. Past and long axis view, what we see, the anatomy we see the left atrium, aorta, LVOT, left ventricular outflow tract, right ventricular outflow tract, all after right ventricle, and then the different walls. We have mitral valve here, and then aortic valve here, interventricular septum, and then the inferolateral, or the posterior wall, commonly called the posterior wall, this one. Interventricular septum, the posterior wall of the left ventricle. So for the 17 segment model, it is aimed to assess wall motion abnormality, that is systolic function of the left ventricle. Wall motion abnormalities, I think I've not told you how actually we grade it, but we have the normokinetic, hypokinetic, akinetic, dyskinetic, and then aneurysmal. You have to score that one. I've not showed you how to score it, but we normally score wall motion. But if you see here, so you have to be looking at these different walls and compare the movement or the excursion, the endocardial excursion towards the cavity. That is the endocardium here. And then you see how far does it go inside in systole. And compare. So when you compare, you can actually confirm that there is wall motion abnormality here. This one doesn't move as this one. Now to determine whether it's a kinetic, we have to tell you that it's not moving at all. Hypokinetic, you see, it doesn't move as much as compared to another segment. So back to the naming. The naming, I've told you this is the septum, roughly septum. This is the posterior wall. But for segmentation, we are going to divide this LV into 3 segments. The basal part at the level of mitral valve, the midi part at the level of papillary muscles, and then the apical part just below the papillary muscles. If we are to make a cut, that's how we shall cut. So the mitral valve, it is the base. Papillary muscle, it is the mid. Apical part, it is the apical, here the apex, we call it apical, and then the aerial apex. So a good Plax view doesn't show the apex, the true apex. This is a very good Plax view. The apex is not seen, and whatever if we were to do a mod here, you see the alignment is good, and even if we were to do on LV, still the cut is perfect. So this is an ideal Plax view. And this is the naming, what we see in Plax. We are seeing the basal part, of the septum and mid part of the septum. We can see those. We don't see the apical parts. But which septum are we seeing here? We are seeing the anterior septum. This is the anterior septum, not the any other septum. Septum is divided into two, anterior septum and inferior septum. So in Plaque's view, we are seeing the anterior septum, and if we are drawing this, we draw a circle there. Remember the other handwritten notes? There was something like this. I named them. So in short axis, anterior septum is going to be here, and then inferolateral wall is going to be here. So if you draw a line passing through those two, you get the Plaque's view. Anterior septum coming first, and then inferolateral or posterior wall coming next. So we are seeing the anterior septum at the base, posterior wall at the base, anterior septum mid, and then posterior wall mid. So what do we say? We are saying basal anterior septum, basal posterior, or basal inferolateral, mid anterior septum, and then mid inferolateral. That's how we say. So this is the base, this is the mid. This is the short axis. At the level, this one mitral valve, fish mouth appearance here when it is opening and closing. Yeah, this is mitral valve in the middle here. So this is at the base, short axis at the base, level of mitral valve. So what we are seeing, you can draw a line joining like this. We will say this is anterior, inferior, lateral, medial. But the medial part is always separating the left ventricle and right ventricle. So meaning the medial part, medial segment is the interventricular septum. So we have anterior, inferior, lateral, and the medial or the septum. The lateral wall and the septum, they are further divided into two. A short axis, we need 6 at the base, 6 segments. We have anterior septum here, and then inferior septum here. And then for the lateral side, we have anterolateral here, and then inferolateral here. So a line can be drawn joining the anterior to posterior or to inferior, anterior to inferior, anterolateral and the inferior septum, anterolateral and inferior septum, and then anterior septum and the inferolateral, anterior septum, inferolateral, anterolateral and inferior septum, and then anterior and the inferior. Those lines can be drawn, and when we draw them, we shall get more views, apical views, and that's how we shall be naming. But for this particular one, let me see if I can put text there. Yes, you see how I've named them here: anterior, inferior, lateral, and the septum. So those are the 4 major ones. So now I'm going to put more, because I told you the septum is divided into 2 and lateral is divided into 2. Yes. So these are the real 6. Anterior septum, inferior septum, inferior, inferolateral, anterolateral. But because it is at the base, because of the mitral valve, we have to add base, basal. We add basal anterior septum, basal inferior septum, basal inferior, basal inferolateral, and basal anterolateral. These things are given numbers too, so I'm going to give numbers also. If you can remember, in my last video, I drew something in a circle, named everything, and then I put numbers 1, 2, 3, 4, 5, 6. We need the 17 segments. So now these ones, we have raised 6 of them in this manner. So the next one is going to be at mid level. you have to compare the contractility, and if you see here, the contractility is the same, yeah, throughout this entire circle, contractility is the same. Okay, maybe one more thing. Remember, these are the two leaflets of mitral valve. This is anterior mitral leaflet up this side, and then posterior mitral leaflet this side. So we have inferomedial papillary muscle here, and then anterolateral papillary muscle here. Anterolateral papillary muscle, and then inferomedial papillary muscle here. So that's what we are going to see in the next. So this is the short axis at the level of papillary muscles. These are papillary muscles. Anterolateral papillary muscle, and then posteromedial papillary muscle here. So again, we are going to do the same naming as I did in the first image at the base. This is mid cavity segmentation, and this is how we are naming. We are maintaining our anterior and inferior, anterolateral and inferolateral, inferior septum and anterior septum. We are maintaining them. And then the numbers, just simple from, we stopped at 6. Now we are starting from the anterior, 7, 8, 9, 10, 11, and 12. But because we are in the mid, so we are naming mid anterior, mid anterior septum, mid inferior septum, mid inferior, mid inferolateral, and then mid anterolateral. This is how we are naming them. And when you check my handwritten notes, this is what I was writing. So now next segmentation in short axis is going to be at the apical level. Yeah, this is the short axis. Now here things are going to change at the level of the apex. Yeah, if you follow our numbers, we stopped on 12, we have 13, 14, 15, and 16. We want 17, the apex is in the middle there. 17 is in the middle, the real apex. Here we are not seeing it, but we shall see it in apical 2 chamber or apical 4 chamber, the real apex. Now, how do we name this apex word? We have the anterior, inferior maintained, lateral, and septum maintained the way I told you first. And now, since we're on the apical side, we're saying anterior apex, inferior apex, lateral apex, and then apical septum. This is how we name them. I told you in the other handwritten notes. Apical septum. Those are 17 segments depicted by numbers. 17 segments of LV. Now let's see what we see in other views. This is the 4 chamber view. 4 chamber, why? 2 atria and 2 ventricle. Right atrium, right ventricle, left atrium, left ventricle. The endocardial lining is there. This is papillary muscle here. We're not seeing there because remember inferior septum. We're not seeing inferior septum here. We are supposed to see some papillary muscle. We can see it here. The coditendinite, these are coditendinite, but the anterolateral papillary muscle is here. Anterolateral papillary muscle, it's coditendinite going to the mitral leaflets. They are here. And then inferior septum papillary muscle is almost there, but it's here, it's not so clear. How do we name the walls? I've told you the real apex, we are seeing it in apical 4 chamber or 2 chamber. And this is the real apex. You see the LV cavity, and this is where it's bounded. The endocardium is there. So the real apex is this one here, 17. 17 is here. So this is anterolateral. This is inferior septum. I can again put numbers. I'm going to use numbers now. But remember, I have to go back to the other images. Where did I put the numbers? For example, anterior, basso anterior was number 1. Basso anterolateral was number 6. So I'm going to put numbers Remember, I've told you that this one is anterior, anterolateral, and this is inferior septum. And this is how we are going to name them. This is base anterolateral, basal anterolateral 6, mid anterolateral 12. The number is 12 if you remember the short axis, the images. And then apicolateral or lateral apex is 16. And then the true apex is 17. If we go on the inferior septum, we have basal inferior septum is 3. Mid inferior septum is 9. And then inferior apex, this one is inferior apex is 14. When you remember the short axis, inferior apex is 14. That's why I'm using numbers. I have no time to use words. But I'm telling you, you go back to short axis, name with numbers. Here I've used numbers. So this is 4 chamber. This is what we see in 4 chamber and how we segment them. I don't know if I took 2 chamber. Let me check. I didn't take the 2 chambers in this particular patient. I didn't take the 2 chambers because it was normal from the start. So the only indication that I use to do 2 chamber is when I suspect wall motion abnormalities. But in this particular one, I didn't suspect, so I didn't do the 2 chamber view. But just know, I've got 2 chamber, we always assume, on 2 chamber, we always assume that this part is not there. The right ventricle and right atrium, they are not there, and whatever we see, it is left atrium and the left ventricle. If it is like that, we close these ones, and we only consider left atrium and left ventricle, then on the right, this side, we shall be seeing the anterior wall this side, and here it will be inferior wall. I don't want to confuse you with this one, but just know in 2 chamber, this one is not showing. We only have left ventricle and left atrium. And if it's like that, then this side will be inferior wall and this one will be anterior wall. And again, you have to go dividing it, basal anterior or basal inferior, mid anterior or mid inferior, and then lateral apex, inferior apex, and then anterior apex, and then the true apex, like that. So with that, I think we have exhausted naming the 17 segments. So next, what shall we cover? A wall motion abnormality, what? Grading or classification. That's what we shall cover in our next class. Thank you.